Good afternoon. Welcome, everyone. We're so excited to have you on today's panel, which is focused on the children's behavioral health workforce and specifically supporting our workforce through trying times. Just wanted to let you all know that Intacc is funded through a grant from SAMHSA and that the voices and opinions you're going to hear on the panel today are representative of, not representative of Intacc or SAMHSA, and are the views and opinions of the panelists themselves. My name is Suki Steckel. I'm with CARS, the Center for Applied Research Solutions, which is the prime for Intacc, which is the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. I'm very excited to be joined by our panelists today and our co-facilitators, Millie Sweeney with Fredla, who's the Director of Learning and Workforce Development. She's going to be helping out with moderating the chat. And our panel will be moderated by Karen Johnson. And Karen is a licensed clinical social worker with 28 years experience in child welfare, behavioral health, community services, trauma-informed approaches, and organizational leadership consulting. She currently leads Social Currents Change in Mind Institute, which partners with organizations and communities using brain science and equity-focused lenses to co-create communities and support better outcomes for children and families. I will give you just a very brief intro to what Intacc is and what we do. Then we'll transition to our panel overview and panelist info and sharing about this very important topic. And then you will have time for a very extended period of time for questions and answers with the panelists. So just a little bit about Intacc. We are a multidisciplinary team and we partner with the Texas Institute for Excellence in Mental Health, the Georgetown University Center for Child and Human Development, Change Matrix, the AAP, Youth Move National, and Fredla, and MedStar Georgetown University Hospital, among many, many other subject matter experts in the field of children's behavioral health. Our goal at Intacc is that all children, youth, young adults, and families with emotional or behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. We serve pretty much the entire children's behavioral health workforce at large. We also focus on a couple of key SAMHSA-funded grant programs called System of Care Grants, Healthy Transitions Initiatives, and Project Aware, but we support clinicians, peer supervisors, family partners, youth partners, the school workforce, primary care, and really the whole mental health workforce, and definitely state and local agency leaders. So if you're involved in the children's mental health field in any way, shape, or form, or with our cross-sector partners like in education, child welfare, juvenile justice, there are offerings with training and technical assistance that Intacc provides, and we hope you stay connected. A couple of our services, which are all no cost and are provided virtually, so you can engage with our TTA offerings live or through recordings. We have individual consultation available, peer learning exchanges, training academies, community of practice, podcasts, and practical tools. So we invite you to check out our website, and we will be dropping some links in the chat over the course of the afternoon. And now I'll pass it over to our moderator, Karen Johnson.
Thank you so much, Suki. And thank you, Millie, and also Joanne Bloom from Intacc that is supporting our time together today. And thank you to all who have been able to join us. I'm excited to introduce our panel in just a minute, but wanted to start with just a few opening thoughts here before we dive into the content. We know that the constant whirlwind of change that was really at play before the pandemic intensified 100-fold during the pandemic, so since March 2020, and in many ways it remains. We know that our workforce has suffered a heavy toll over the past 22 months. And despite increased efforts to support staff and really leaders in our organization moving mountains to make it happen to support staff, evidence indicates that staff morale and satisfaction have suffered. The O.C. Tanner Institute, which does research and education on culture and employee experience and recognition, reports declines in 5 of their 6 talent magnets. So here in this slide, we see that in the 2022 report, a sense of purpose, a sense of opportunity, sense of appreciation all declined. And as you know all too well, workforce shortages are impacting delivery of services across children's mental health and throughout our sector. So I just want to share this thought as we get started in our panel today. It comes from Amy Edmondson out of Harvard, and I'll just read it. Too many are asking when we will go back to normal. To me, the problematic word is back. There's no going back to pre-COVID times. There's only forward to a new uncertain future that is currently presenting us with an opportunity for thoughtful design. And I love this quote. First of all, I love the picture because, you know, again, we're moving forward into a new day, a new era, a new sunrise. And so our work right now is to sort out how we learn from the pandemic, how we leverage the many opportunities we have for thoughtful new redesign of the work ahead. We know that our workforce, we talk about it often, is our greatest asset. So what are we going to do both internally in our organizations and throughout our systems to ensure that our workforce, especially in children's mental health, is its needs are met, and we are partnering with them, moving beyond the self-care piece, which is what we did very well pre-pandemic. We're moving past that, the self-care piece, to partnering with organizations in this work to create workforces that are resilient and can do the work that we have ahead of us. So I'm really excited. Today, we're going to hear from experts in the field. They're going to share their experiences and strategies for supporting staff and the entire workforce in the current environment and preparing, you know, ensuring that we're resilient and prepared for future crises, because there will be future challenges ahead, as we all know. So we're going to hear about successful examples of policy change, workforce recruitment and retention strategies, and community engagement efforts at the state and local levels. I'm going to stop sharing for a minute, and we're going to actually, I stopped sharing a little too soon. I do want to share this slide here. So you can see the really amazing panel that we have with us today to talk about this work from many different perspectives. So there are their pictures and their names for you to look at, but now I'm going to take it down again. And we're going to go one by one very briefly to have about short 30-second, 45-second introduction from each person where they can share whatever they want to share for you to hear about them. So we're going to start with Amy Green, who's a clinical social worker and founder of Nashville Collaborative Counseling Center and the Rooted Bridge. Amy?
Guys, I am Amy Green. As Karen said, I'm a clinical social worker. I've been working in the field for over 15 years and am the founder and CEO of Nashville Collaborative Counseling Center, which I started in 2019, and it's experienced pretty rapid growth and is an outpatient mental health practice that specializes in trauma and maternal mental health. The Rooted Bridge was founded in 2018 and focused on creating access to maternal mental health care across the state of Tennessee.
Thanks so much, Karen. Amy. Thank you. And Jean Supin, Senior Consultant and Faculty Member, National Council for Mental Wellbeing.
Hey, y'all. I am Jean Supin. As Karen said, I'm a consultant with the National Council for Mental Wellbeing. I have spent decades of my career dedicated to leadership, management, and supervision excellence, and I work mostly with large mental health and substance use recovery organizations, those that are large and typically funded mostly by Medicaid across the whole country. I live along the second oldest river in the world, in the Southern Appalachians, and I'm delighted to be here.
Thanks so much, Jean. And now we have Ruth Fox, the CEO of Allegheny Family Network.
My name is Ruth Fox. I'm the CEO of Allegheny Family Network. We're a family-run organization, and so we are peers that support other peers in Allegheny County. I have a background in working in the community. I was a nurse, but I really decided I liked social service. And I ended up working in the community in a church setting for 10 years while I was raising my children, and then moved to a mental health agency and worked in adult residential programs for 10 years. And then became the CEO of Allegheny Family Network. So that's been my journey. I left nursing for social services. I'm really happy to be here with you today and share.
Thank you so much, Ruth. And Belisa Urbina, CEO of Serra Familia.
Good afternoon. My name is Belisa Urbina. I am co-founder and CEO of Serra Familia. Serra Familia provides family, social, and mental health services to Latinos in 5 offices in Metro Atlanta. What we do is take a family from a moment of crisis and then help them along the way until they are really thriving. We serve about 6,000 clients every year, and it's an absolute pleasure to be part of this panel.
Thank you so much. And then Mary Shelton, Director of Behavioral Services at the Division of Tencare.
Hi, everybody. Hello from Nashville. I'm Mary Shelton. I'm the Director of Behavioral Health Services for the Division of Tencare, which is the state Medicaid agency for Tennessee. I have oversight of all of the mental health and substance use disorder benefits for the Tencare program in Tennessee. So it's great to be here. Thank you so much.
Thank you, Mary. And then our final panelist is Matt Yancy, Deputy Commissioner, Tennessee Department of Mental Health and Substance Abuse Services. Matt?
Hey, thanks, Karen, and good afternoon. Also from Music City. I actually just saw Keith Urban walking into the place I had for lunch. That was kind of cool. Nicole Kidman was not with him, unfortunately, but I saw Keith. As mentioned, I serve as the Deputy Commissioner for the Tennessee Department of Mental Health and Substance Abuse Services. I've been with the department almost 7 years. Previously, I was with the Georgia Department of Behavioral Health and Developmental Disabilities. I've worked in K through 12 education, doing school-based mental health. Started my career in child welfare. I'm a licensed clinical social worker, and really happy to be with everyone this afternoon. Thanks, Karen.
I did want to note that what we're going to do now, just so you're aware, is each of our panelists is going to share maybe 7 minutes-ish, their perspective, their unique perspective and experience and strategies that they have been using in their own work to address this concern we have of meeting the needs of workforce, especially in children's mental health. So, and then after that, we'll hopefully have around 25-ish minutes for questions and answers. So feel free to put your questions in the chat. The Intacc staff will be monitoring the chat, and we will collect those and definitely have a Q&A session in which we can hear all of our panelists contribute to a nice conversation. So that's our agenda for the next, the time ahead of us. And we are privileged today to start with Amy Green.
Such a pleasure to be here with you guys today. I'm excited to present and talk about just kind of the landscape that we're dealing with and lay it forward. Our market is, I continue to refer to it in conversations as like the Wild Wild West, because it feels very much in the past couple of years like things have radically been disrupted and transformed, and they have in so many ways. So we have a strong, what's called a bull market. You might hear us talking about a bear market as we kind of head into recession, but the mental health investment is considered a bull market. We've had $3.1 billion in mergers and acquisitions and private equity funded through September 2021. The last highest year for comparison was in 2009, right before the last recession. So really interesting kind of movement and shifts in some very big ways. When we have that much money coming into a market, we will see our market rapidly change. This means that we're going to have larger firms over the next 3 to 5 years, large consolidations of practices that will be generalist. We also have retail-based mental health care that we've seen come out and start to get very, very heavily invested in. You have CVS, which is owned by Aetna, Walmart's, walk-in clinics, all those kinds of pieces, an on-demand model of care where people can walk in and be treated and seen. So it's meant to be one-off or crisis or, you know, a few session treatments. It's not meant to be long-standing for your EMDR-like models, but still, again, another really big disruptor to how we've been practicing. I think one of the largest disruptors has been our online tech companies, BetterHelps and Talkspaces, promising salaries of 100 grand or more for freshly licensed clinicians, able to grow and scale in some big ways, and also a ton of, I'm going to call them unresolved ethical dilemmas, as we've seen with Cerebral recently getting kind of dinged and walking through some of their, just accountability for how they practice and prescribe, right? So a lot there that needs to be figured out, but a huge disruption to our industry. A lot of clients who are able now to access care in ways that they weren't prior. And then value-based care. Over the next 3 to 5 years, we'll see value-based care models really mainstream and come down through insurance companies. I just attended a conference a couple weeks ago on value-based care, and they're talking about companies like United who have really strategically invested in partnerships that support and will empower this model of care as we go forward. So how are we measuring data as agencies? How are we accountable for data? How are we moving to this transition? Are all going to really impact how we're planning and hiring right now. So moving into solutions, because that is what we're here for, are the solutions that I have found to be the most impactful, the most effective, are filling our funnel, our employee funnel, the balance of internal, external incentives, and then ongoing engagement and niching and specialization. So when I talk about an employee funnel, the employee funnel is similar to a sales funnel, right? And it's treated as such for multiple reasons. When the employee starts to come and apply for a job, that is your first impression with them. And the more that you treat it like a sales process, they're coming to you, they're coming to us for specific reasons. They're looking for other employers or another job for a specific reason. If you treat it as a sales process and identify pain points, right, which is how they would, the sales language, you're going to have compelling reasons to empower them and kind of link them into your hiring process. So when employees are looking and applying, a response time is also another really important thing to think about. How long are they waiting for responses from you to schedule the first interview, schedule the second interview, get the onboarding, hiring letter, offer sent, all those pieces. Having a compelling sales page is going to be really important for your therapist. Again, why would they want to work for your organization over others? What sets you apart? The interviewing process, trying as much as is possible with all the people that are involved in interviewing to make it happen quickly is going to be the most effective way that you're going to be able to have and lock in hires. Only essential people then are included in interviews. So anybody who's not necessary, try to weed them out of that process. We've gotten very clear also about our interview questions and what is essential for a role. I can give examples of that. We have hired crisis therapists in the past who come from crisis intervention experience, and it has not worked out well as far as transitioning from crisis skill set to outpatient therapy skill set. And so we've gotten very clear about who's going to be a best match, who's going to be a best fit, and what skills do they need to onboard well with us and then retain. If you want to go to the next slide, Karen. So some other things to think about when filling the funnel, not relying on just Indeed or LinkedIn. What relationships do you have in the community to fill that funnel? I have sent so many emails to peers, colleagues, universities. Our internship program is another huge way that we fill our funnel. So I would really encourage you, like Power 50, look at your 50 in your network. Who are those 50 people that you want to be, need to be connected to, that need to know that you are currently hiring? Applicants are looking for flexible schedules, more autonomy, working with clients that they love, people that make them come alive, stories that make them come alive, and getting paid what they deserve, right? So what are ways that your organization meets those needs? and can then compete with your Better Helps, Talkspaces, and other employers who are offering those. Interviewing, again, making sure that your process is as streamlined and as possible, have electronic solutions for storage that's confidential, include e-signatures wherever you can. We use a program called Bamboo HR that's been incredible for onboarding and capturing kind of all those points of the process. Thinking of onboarding like a Disney experience. It is your first impression that matters. How are we welcoming them day one? What does a hybrid culture look like? How are we engaging with them? Introducing them to important people on their team. Have both in-person and online days as a part of your onboarding experience. And then when they have heavy online days, how are we building in that time to get off of the computer, off of Zoom, so that they have some space as well. We also work really hard to ensure that they have a clear training schedule, that they know exactly what to expect, what links to go to, and when they're expected to be in places. And retention is another important part of the conversation, and the last part that I'll offer today. How are your team members and your team engaged in ongoing and invested in? Are there CEU reimbursements or training contract incentives, which is something that we've offered and has been a huge thing. We've offered to pay for EMDR with an offset of payback if they leave sooner than the contract establishes. What are growth opportunities internally? Our current hires really care deeply about growing. They care deeply about mission. And so they want to know, like, and see themselves in your leadership and how they can track towards leadership opportunities in the future. How is feedback built in? So how are they giving feedback? How do they feel about when they give feedback? Is there space and safety to give feedback? And is the employer responsive to the employee needs as much as is available and possible? And when you're thinking about bonusing, profit sharing, and incentives, there's a ton of job applications online that offer bonuses to hire and incentives to hire. How are we also then still applying that to our current employees as well? So if my hiring bonus is a $5,000 sign-on bonus, how am I still retaining my current employees and offering them an additional $5,000? The VA did something really interesting recently. They did a retention bonus at 10% of the salary, which is a lot of money, across the board. And then they paid that out over the next year. So again, what are strategies to hire people? But then also, how is that strategy being utilized to retain the people on my team currently? I would love to answer any questions as we get down the road more and hear from our other experts today.
Thank you so much, Amy, for that very just insightful oversight. I love how you started the Wild West, but it strikes me that many of the things that you offered related to our market goes back to relationships, understanding that our staff are human beings who have significant needs and important needs, and we need to partner with them in this journey. And that is some of the things we've learned from the pandemic for sure. We knew it before, but now we have to operationalize it. So thank you so much. Really helpful information. And now we're going to move on to Jean Supin, who is going to bring us a focus more on the organizational culture, I think. So go ahead, Jean.
Yes, thank you, Karen. And thanks, Amy. That was a fabulous, quick description of what we can do. And so what I'm going to add is definitely a complement to what Amy is saying, not, sort of an alternative, but I'm really looking at, again, I work mostly with large organizations, typically mostly Medicaid funded, offering a wide array of services to all folks of all ages. And, these are legacy organizations that have all the beauty of a legacy organization, which means a depth of experience, opportunities for growth over time. But there also, as legacy organizations, sometimes we feel a little cumbersome. And there's a lot going on, and there's a lot of things we don't necessarily have control over. And so I'm going to focus instead, keeping with this theme, I'm going to focus on a couple of things that we know we can actually not necessarily control, but where we can put our time and energy and reap a benefit that really the behaviors, the management behaviors and the management culture that we know fosters engagement and vibrancy, especially in, again, those large legacy organizations. Next slide, please. You know, at the end of the day, whatever we invest in our supervisors and managers comes back with great benefit. And so that's really the next slides are really focusing on things that managers and supervisors and leaders can do on a regular basis that, again, foster engagement and vibrancy among staff, particularly staff who've been around a while, and you want them to stay and you want them to feel energized in their work. So I'll cover 4 things quite briefly: strengths, meaning, wholeness, and what I sort of loosely described as kinship and allyship and advocacy. So first, with strengths. As managers, we should know what our staff strengths are. We should talk about them. We should engage them in diving into and understanding their own strengths. And by strengths, I don't necessarily mean the things that they're good at, but rather the things that they love doing, that keep them energized, that bring them sort of that lift at the end of the day. And conversely, knowing what really drains and exhausts our staff and having lots of conversations about that, and then asking on a regular basis, as a manager, as a supervisor, as a leader, how can I help you do less of what you hate doing and do more of what you love doing? It's kind of that simple. So that's the first piece. Second slide, please. The second area we can emphasize is meaning. People come to work, as Amy described so beautifully, people come to work with a deep, deep sense of passion, a deep sense of meaning. That's what led them to this work. That's what led them often to your organizations. And so continuing to have that conversation when you can. Why are you here? What fulfills you? What brings you meaning? And then as managers and leaders, connecting individuals' answers to those questions with the broader meaning and mission of the organization. And again, asking every day, how can I help you do more every day of what fills you up? Next slide, please. The third area is what I sort of loosely describe as wholeness. I couldn't quite figure out a better word for it, but it's really understanding, again, as managers, supervisors, and leaders, it's asking always, who are you? What are your quirks? What are your, again, going back to strengths, what are your work styles? What fuels you? What do you bring to your work, your experience, your ambitions, your passions? How do you work best? Do you like a lot of direction? Do you like to be left alone? Are you an introvert or an extrovert? Some of the questions are pretty basic, but making sure that we know and we engage with staff, we learn about them, we encourage staff to learn about each other in this regard. And then we again, as leaders, managers, and supervisors, even as colleagues, what can I do to help you work in ways where you personally as an individual are most successful? And how can we rearrange schedules even? How can I give you the kind of work and give you the kind of direction or collaborate with you in the ways that work best for you? So you then in turn can be successful in your work. And then finally, the last piece, next slide, is I didn't really know how to label this, but if we're serious about not only retaining staff, but maintaining a workforce, particularly in large organizations, a workforce that's committed, that's engaged, that's excited and vibrant, we have to take diversity, equity, social justice, allyship, kinship, advocacy really seriously every single day. So starting or continuing conversations about how do you define yourself as a cultural being? What is your cultural identity? What experiences have shaped that cultural identity? And how does that cultural being, that cultural identity, those cultural touchstones really benefit your work? And then most importantly, how do I, again, as a colleague, a supervisor, a manager, a leader, how do I ensure that each and every one of you, one of us, feels welcomed, included, supported, connected, equitably valued, and rewarded here? And how do we continue to dive deeper and deeper and deeper into these questions and I don't even know what to say, the gifts that we all bring, and breaking down barriers that might get in the way of that. So again, I was given 7 minutes, and I just, in thinking about, again, you may not have a lot of control over certain things, particularly those of you who are working in larger, more legacy organizations. You may not be able to control with great flexibility salaries. You may not be able to control workload, particularly growing workload. You also can't necessarily control the stress those you are serving, your communities, and even your staff are experiencing. And yet these 4 things are areas that you can put your time and attention to. And when you build those pieces in a really, really deep and meaningful ways in your culture, that does encourage engagement and vibrancy and just a deep sort of satisfaction and meaning in our work. And that's what we want. So with that, Karen, I'll pass it back to you.
Thank you so much, Jean. So much that you said just, resonates with what we've learned during the pandemic and about, this organizational culture and moving beyond self-care, which is what we all know we learned back in the 90s and the 2000s. Make sure you eat right and take care of yourselves, which of course is all relevant and very important, but so much of everything you said is about this partnership, this relationship. And I would note that I also heard a lot about, while you can't control all the driving forces outside of your locus of control, you can influence your own personal journey and how you impact others around you. So thank you so much for sharing that. And now I think very nice segue into talking with Ruth Fox, who brings to us knowledge and expertise and her whole career around supporting a peer workforce that is supporting parents and families. So go ahead, Ruth. Thank you.
Hi, I'm so happy to be with everybody today. And I am the CEO of a family organization, so a little bit different than some of the things that have been shared already, but certainly I hope you find some value in it. So I'm going to tell you I'm going to start off with just telling you a little bit about something that happened in my life, my work life, and then how it led me into where I'm at today and working in a family organization. In 2008, I was at an agency and I was the program director of adult mental health residential programs and was offered an executive director position of a family organization. And since my daughter had major reoccurring depression and agoraphobia, I was kind of the perfect candidate for that position. And I was so happy to get it. And then from executive director, became the CEO. A family-run organization is an organization where peers, which is what I was, I'm a peer, and we hired other family members who raised children with mental health or behavioral concerns. And it's a great opportunity to build a workforce like this. And I wanted to share a little bit about that with you. Raising a child with a mental health need brings you learn many strengths, but you overcome many things as well. And working is difficult. Our children, many times you get called from the school, you have to go pick up your child. How do you maintain a job when you're getting calls and you have to leave? So going into this position, I knew I'd have a different kind of a workforce, and I had to look at our parents and say, what can I do to help maintain their positions and have some retention with our staff. So with that being said, everything we do is from our lived experience and also a lot of training. We have a lot of credentials and certification that we do with our family support partners. But we decided early on that we had a different kind of a workforce. And for that different kind of a workforce, we needed different ways of handling it. And one of the ways that we decided that, this is kind of what we needed to do. Everyone at AFN had a work week of 37.5 hours. And of course, we worked 7.5 hours a day. But every morning, I gave my staff time, 15 minutes, to meet together and to talk about everything that could have occurred at their home the night before because they were raising children with difficult situations. And so that gave them and made them ready to be able to go out and support other parents. That 15 minutes was part of their 7.5-hour day. AFN also, when we hired people, we knew that sometimes we were going to have to ask people to work evenings and weekends because many of our parents had jobs. And so they would have to be able to kind of control their schedule to do that. We knew that they'd be getting calls to come pick their kids up at home. And so again, it was another thing we thought they're going to have some control over their schedule. So with their Outlook calendars, when they had to get called away, they would talk to their supervisor, they'd get supervisor approval, and then they'd adjust their calendars. That way the supervisors could ensure that, they were logging in their time accurately. We also sometimes had to rearrange appointments that they had with families so that they could go do what they needed to do. And if the family really needed to see someone, the supervisor would fill in for that. So we figured out ways to make it work. We were also generous with the amount of PTO. For instance, in their first year of work, we gave 20 PTO days, of course, prorated to their hire date. And then we have 11 holidays that they had time off. And we were since we're so family focused, we gave 3 days at Thanksgiving and 3 days at Christmas. And this really worked and helped the staff. On their 6th year of employment, they would get 32 PTO days with the 11 holidays as well. So we tried to be very generous with time off. We knew about and understood the stress that the family was feeling at home, and yet they were out in the workforce giving to other parents. AFN also, of course, during COVID, our staff would go into families' homes and do face-to-face visit, but during COVID, we decided we had to do something different. And so we went virtual. And so we seen families virtually during that period of time. And now we're kind of hybrid where we do a little bit of both. And so that flexibility was really good for our staff as well. We do things like our office hours start at 9 o'clock, if we have an employee whose child goes to a therapeutic daycare, and that may not open till 9 o'clock, and then they have to get to work, we would just adjust their start time. Uh, so adjusting and giving them the ability to kind of adjust their schedules to meet their needs really worked out. You know, statistics show that during COVID, a lot of women left the workforce, and it was a lot because their children were not going to school, daycares were closing, and they just, you know, someone had to be with their children. And so we learn how to kind of adjust in different times. And we believe that our retention, we have very good retention of staff. And we think that's because of the flexibility that we give them, allowing them to meet their needs and still be able to be part of a workforce. And so I just kind of wanted to share that. It's something we did not so much because of COVID, but we did because of who we were hiring. So I hope that was meaningful and helped somebody.
Thank you so much. Thank you so much, Ruth. You know, you are really modeling, I think, what we're talking about as we move out of COVID for many reasons. We know our staff live in the environments in which we work often, and the communities in which we work. So, and we also know that because of COVID, many more families and children are experiencing stress, which maybe is leading to increased needs and challenges in the household. So of course, parents are, well, we know that they multitasked and did school at home, et cetera. And now even post-COVID, as kids are back in school, there still are increased needs that we all need to understand persist. And your model is exactly, you know, the kind of model that can help us retain our workforce. So thank you. Thank you very much. And then we're going to now move to Belisa Urbina, who's going to talk with us about her work at her organization, Ser Familia. Thank you.
Thank you very much. I guess I have been listening to all of the great ideas that have been shared, and you know, learning as well on new skills and new practices that we can implement. In our case, our organization serves Latinos. We're very culture specific to that community, linguistically specific to that community. And something that happened during the pandemic was that we realized that we needed to stay open. We never transitioned to virtual services, none of the services that we were doing. And we have to sprout, as I say, new heads. We have to start doing programs that we did not do before, like food relief, emergency financial assistance, and other areas, because in some of the counties that we serve, we were it. We were the only place that our families, our Latino families could come, especially if they were undocumented or mixed status. We were the only option for them. So, you know, how do you keep your staff, you know, motivated, feeling safe, and engaged in a situation like that? In our case, it was helping them feel a sense of purpose. They were doing something that was bigger than themselves. We were doing something that was bigger than ourselves. I guess that at some point during the pandemic, we were the only ones coming and going, you know, and that's very striking in Atlanta, where traffic is such a nightmare. So for many days, it was that sense of we are doing something here that is big. First of all, it was so important that they felt that as I was asking them to stay, you know, in person, we as leaders were staying in person. So normally I work out of our main office, but during that beginning of the pandemic, I'd make sure that I would rotate in between the offices so they could see me, that they would know that I was there. All my staff knows that I have a heart condition, so they knew that I should stay home, but if I was asking them to do that, I was going to do it myself. I was going to help them engage. As we were doing all of these new things, you know, it was every day, how do we approach this? And it was always a sense of purpose. You know, our families are hungry and we found milk that is donated, but we don't have commercial refrigeration. Everybody went home and got their beach coolers and we put them all over the office to store that milk. So I think that helped a lot, especially also when you're dealing with a workforce that reflects the community that they serve. And that is very important because we hear a lot about hiring a diverse workforce. In our case, is Latinos, yes, but it has to be Latinos from different places in Latin America. I am Puerto Rican, but that doesn't mean that I can hire all my staff from Puerto Rico. They have to reflect the Latinos that we serve. And they also have to feel that they are directly benefiting that community. They have, as I said before, to understand that you're going to keep them as much as you can out of harm's way. We did a lot in terms of, you know, things that we could find to help them. In the beginning, I struck a deal with one of the hospitals that is one of our donors, and they took, you know, masks out of the hospital and they will meet me in the dumpster, literally, to give me the mask. And I will show my staff how to reuse those masks. How do we get gloves? We went to a dentist that had her office closed. Can you let me have your gloves, the ones that you're not going to use? So every day they knew that the rules were going to change every day. We imposed a mask mandate in our office way before people were talking about that. By the second week in March, we had a mask mandate everywhere. And, you know, I hear a lot that other agencies had a lot of resistance. In our case, everybody was like, this is what we need to do, not only to keep ourselves safe, but also to ensure that we are protecting the community that we love. I was sharing with Karen the other day when we were talking that for me, it was absolutely heartwarming. The first time that we have to serve a client that we knew was COVID positive. I'm talking about probably last week or last week of March 2020, first week of April 2020. And the case manager that was supposed to take that intake, she was like, I have no problem, I'll do it. And then I get, you know, a call from somebody else in that same location saying, you know what, Miss So-and-so shouldn't do that, you know, that she has asthma, so I'll do it for her. Third call, Miss So-and-so just called you, but you don't know if she's trying to get pregnant. I'll do that. So I was here in my desk and I was boo-hooing because I was like, everybody's running away from COVID and my whole staff is running towards it. So, you know, I make sure that I highlighted those things, that I constantly told them how proud and, you know, inspired I was by them. We found ways of giving them bonuses, you know, because many of them had spouses that lost their incomes. Extra time off, make sure that if anybody got sick, they had enough time to recover. Nobody felt the pressure of having to come back, you know, to the office while sick. Because we were keeping them, taking care of them first. Another thing that we do a lot, serving a community that is a minority community, is advocating for the needs of mental health, especially for children. Right now, as a result of the pandemic, we're seeing the number of sexual abuse cases in children. You know, every quarter we see the number that we normally see in a year. So right now is also, you know, we need to increase the amount of providers, not only in our agency, but as a community in general. So I've been advocating with legislators, with State Department. We need to make changes to the way that people get licensed in Georgia, because if you come from a minority community, maybe you don't have a family that can back you up and you're going to graduate with a master's with a massive student debt, and then you cannot pay 1,800 hours, supervised hours, while maybe earning a salary that is less than what you were expecting. So you get people that get their master's but never get licensed. So we have been advocating for those changes, but also on the other hand, ensuring that we hire people fresh out of college with the same salary that maybe somebody who is licensed. And then we pay for that supervised hours to ensure that we're helping the community gain capacity, not, you know, in general. So those are some of the strategies that we have used through this time. Happy to share more later in the Q&A.
Thank you so much, Lisa. First of all, thank you for how you talked about your sense of purpose at your organization. I think it's a thread that we've heard everyone speak to already. And we know that research shows that matters for people, that matters in so many ways beyond what they're paid, et cetera. Sense of purpose, being connected to mission. You totally showed us what that means. And then thank you for talking about the work at the state level in Georgia, which transitioned us really nicely to our final two panelists who are going to share together here. We have Mary Shelton and Matt Yancy, and they're going from Tennessee, and they're going to share a little bit about their partnership around Medicaid and around building workforce networks or partnership networks in Tennessee and the success that they've had. So Mary and Matt.
All right, good afternoon. First, just want to say thanks to Amy and Jean and Ruth and Belisa for their comments. Belise, your point on advocating with stakeholders cannot be underscored enough. And it does transition well into Mary and I's presentation, because we're really fortunate to work on a state level to help make changes related to policy, related to funding. So thank you for bringing that up. We'll go into the next slide there, Karen, and then the next slide. For the providers on the phone, the direct service webinar, rather, I do want to first say thank you for what you're doing. The past couple of years has not been easy for anyone, and to have providers on the front lines continuing to serve people with mental health and substance use issues is a really big deal. Our department, Tenncare, we are the payers for the public behavioral health system here in Tennessee. And when we talk about the public behavioral health system, we're talking about serving children living with serious emotional disturbances, adults with persistent mental illness, and those living with substance use disorder. And I will tell you, I say this all the time, we as a department are only as strong as our network of providers. We do not accomplish our mission. We do not realize our vision without a provider network that has the resources they need to do the job. And Tenncare and our department actually share the same provider network. As we continue to work with the providers and learn more about how we can be helpful, one of the things that became really clear about a year ago is that we need to look at the workforce issues among the provider network. And what we did is last summer is convened a work group that had three main goals, one of which is to clearly identify needs and gaps related to the public behavioral health workforce. The second goal was to assess for strategies. And the third was to develop a report that could be used for key decision makers across state government around the workforce challenges here in Tennessee. This work group met 3 times last summer, in the summer of 2021, and it was a diverse work group. There were providers there from the public behavioral health arena, various trade organizations, advocacy groups such as NAMI, Mental Health America, and then really we had a pretty amazing turnout from our partners in academia, both on the college and university level. And then Mary will talk a little more about this workforce work group and the strategies it identified.
Sure. Thanks, Matt. So as you can see here are our highlighted strategies. There are about 8 of these strategies that the workforce identified. And so they fell into 2 short-term strategies focusing on retention and re-energizing of the current public behavioral health workforce, and then long-term strategies focusing on recruiting the next generation of public behavioral health workers. So real quickly, I'm going to highlight these strategies. So first up was payer reimbursement rates, which I know as providers, this is definitely a hot topic across the nation. but looking at ways to possibly identify means to fund and implement possibly sign-on bonuses or annual stipends, partnering with colleges and universities to provide tuition assistance, paid clinical supervision hours. So these were some of the ideas that the work group came up with. Around employee-focused benefits, to continue to cross-train staff across inside the organizations, regular trainings. There was a lot of discussion about trainings within the work group. Looking at research and exploring cost of services. Again, back to the rates that either the payers are paying or that the providers are being paid. Looking at the actual costs of the services. Very hearty discussion around diversity and inclusion within the public behavioral health workforce, looking to invest in talent management for individuals already employed. And I know we've heard a little bit about that. There's the recruitment, and then there's focusing on the employees that are already working. And then also looking at a long-term goal of recruiting a workforce that closely resembles the population served. So that helps to foster mentoring relationships and support those in the community. Also expanding internship opportunities. And I'm going to talk a little bit more about this here in a minute, where Tencare has been able to start some reimbursement here, but looking at how we can focus on that pipeline, the pipeline planning, getting the students connected with possible, employment at agencies, building that stronger pipeline. There was a lot of discussion around loan forgiveness, and then also around behavioral health licensure. And it was just discussed a few seconds ago about, how do we help those who need that supervision to get supervision that is possibly less costly. So again, these are some of the ideas that the workforce work group came up with. We haven't been able to implement all of these yet, but they are definitely on the launch pad. And I think Suki put a link in the chat, but then you can also go to the Department of Mental Health's website at www.tn.gov/behavioral-health, and you'll be able to access this publication. All right, Matt, I'll turn it back to you.
Yeah. So wanted to highlight some of the recent workforce initiatives that have happened since the workforce work group was developed. You'll notice when you look at our report on the link there, I think it's less than 20 pages long. And that was intentional because I think we recognize that people like in the picture here, our governor and our chief operating officer and our commissioner for finance and administration, these are very, very busy people. So we wanted to create a report that clearly outlined what the issue was and what the aforementioned strategies are as identified by the work group. Really, the first one that was brought up was around rates, provider rates. And our department requested about $38 million for next fiscal year to support recurring state dollars to support provider rate increases. We're really fortunate to receive half of that. So we are getting almost $18 million in new state funds to raise the rates among all state funded providers here in the state across prevention, early intervention, treatment, and recovery, looking at the broad continuum. We do plan on for fiscal year 24 in requesting the other $18 million because we know that while this 18 million is a huge, huge difference maker, the need is still there. Another thing that we just launched in partnership with the University of Tennessee College of Social Work, and Suki, I think, has been involved with this, is to do more outreach among high school students. So connecting with young people before they decide where they may go to school, where they may go to college, and really educate them on the value and meaning of a public behavioral health job. The third thing that we continue to do, and Tennessee's got a really strong track record as it relates to leveraging lived experience, we are continuing to prioritize hiring certified peer recovery specialists across the continuum. We have them working in our crisis stabilization units, in our state hospitals, responding to people in emergency departments who present due to drug overdoses. This is something that we're not taking our foot off the pedal with as far as engaging more people with lived experience and helping bring them into the workforce. We recently launched a youth and young adult certified peer recovery specialist training program. When I first got to Tennessee 7 years ago, we had trained over 1,000 people with lived experience to be CPRSs. And I think you could count on one hand the number between the ages of 18 and 25. So we recently launched a curriculum just for young adults, hoping to augment and supplement our workforce with more young adult peers as we move forward. Next slide.
All right, and I'll pick it up here. These are some of Tencare's recent workforce initiatives. So piggybacking on what Matt was saying, as far as the provider rate increases, Tencare asked for 12 million and we were able to receive all of this. And this is also recurring. We're looking at some across the board provider rate increases on medication management and therapy. We're looking at rate increases for some substance use disorder providers, and then also some rate increases for an intensive in-home service when they are able to use a master's prepared professional, in hopes to retain those who are working at the community mental health centers. Then we're really excited about what we're able to start July 1 of this year. Tencare will begin reimbursing for therapy provided by graduate students. So this will be for, like I mentioned, therapy services at licensed mental health agencies. And they have to be obviously within the Tencare network. That therapist, the graduate student therapist, must be supervised by a licensed provider. And then the agency works out an agreement with that college or university. So again, we're hoping that this helps that pipeline, that recruitment pipeline. I've sat in the offices with several CEOs of the community mental health centers across the state, and they let me know their best source for new workers are from those practicum placements or the internship placements. And it allows for the student to get to know the agency and the agency to get to know the student. So we are hopeful about this project. Also, we have a survey right now currently in the field for our community mental health centers. We're needing to better understand what the staffing issues are. And we're hoping to gather information on wait times or wait lists for initial and subsequent appointments. And I think this has been mentioned several times throughout the presentation, but I'm going to say the word again, to help us advocate. It helps us as policymakers determine where and when to ask for resources. And then when we talk to the government leadership, to advocate for those dollars. So we're excited about these initiatives. All right, next slide, please. And so I will kick us off with next steps. Pretty much our theme here in Tennessee is collaboration and communication. So with the Department of Mental Health and Substance Abuse Services, Tencare, our 3 contracted managed care organizations, the multiple mental health and substance use disorder providers, the trade organizations that represent those providers, our advocates through NAMI and Mental Health America, and definitely the colleges and universities. We're going to stay in touch. We meet regularly through different work groups, through ad hoc meetings, through regular meetings, but this is how we know what is going on throughout the state and how perhaps maybe we're making some changes within the workforce. Matt?
Yeah, and the public behavioral health workforce work group that we convened and facilitated last summer, not only did it lead to a lot of these cost enhancements that we're seeing in our budget for next year, it also spurred, as you can see here, this new legislatively created healthcare task force that's going to look at healthcare, public healthcare services in general across the state and take a really hard look at the rates and reimbursement for those services. This task force, I think, is beginning here in the next couple of months, and we'll be a part of that, as will Tenncare. And then I also referenced what we're planning to do for fiscal year 24, which is odd to say, even though we're not even in fiscal year 23, we're starting to develop budget plans for it. And our hope is to ask for additional funding to help address some of the workforce challenges in the state. The last thing I would say to the folks on the call, if you're interested on how you can drive these conversations on a state level, I would really encourage you to get with your state departments of behavioral health and ask how you can be a part of their planning and policy councils. So every state receives a mental health block grant through SAMHSA, and all states are required to have planning and policy councils to help drive decision-making, to help prioritize how funding is used. If you're not a part of those, I would encourage you to do it, because a lot of what we've done here, Tenncare in our department, has been driven by the voice of our planning and policy council. So again, would encourage you to reach out and get engaged that way. Thank you, Karen.
Thank you so much, Mary and Matt. What an amazing overview of what all is going on in Tennessee at the state level, and amazing partnerships that you're promoting and bringing forward. I loved it all, but I would especially listen to the piece where you're asking you to send a survey to your CBOs, your partners in the field, seeking feedback to sort out what's going on and what could be most helpful. And of course, your work group, and then the creation of the healthcare task force. So many amazing things you're doing. So thank you so much. And now we have come to the time in our last half hour of our time together, or less, to have question and answers. So this is the time for everyone on the call to share, to put out questions, things that are that have come up for you as you've listened to the panelists speak. And as these questions come in, I will just ask our 6 panelists to respond. Some of them are directed towards specific people. And this first one is for Amy. Amy, how is your organization funded? And how do you build in retention bonuses into your budget?
Sure. So our agency primarily is funded by commercial insurance right now. We're in the process of paneling credentialing with Medicaid in our state. We have about 5 to 6% maybe private pay and deep sliding scale. So primarily driven by commercial insurance rates. With retention bonuses and stuff, I have learned this the hard way. A couple of years ago, made the mistake of trying to forecast this on my own, and just, hard learned lessons, right? So I had contracted with a CFO who helped me to build out a forecasted model of different types of incentives. And so we landed with a profit sharing model that felt like the least riskiest, but also incentivized our clinicians to meet their goals, hit their hours that they are required to hit, and also sharing profit, which I think is an interesting, gosh, I could go into that, the social justice reasons that we should share profit of mental health agencies. But, agencies that I've worked for in the past, large agencies that are in NASDAQs, and I'm seeing lots of money for their CEOs and everything. And as a baby social worker, was not reaping the benefit of that. So trying to figure out ways to strategize and not just make it a bonus, because a bonus is helpful for sure. But I would rather see us create longstanding change and I don't know, honestly, like put profit into our employees because they help us build our companies, right? With forecasting, I contracted a CFO. Her name's Amy Lilibierte. I'm sure she would be happy to support anybody who's interested. She's a CFO and she does a lot of my accounting now. And she's incredible, but I would say any CFO that knows mental health business is what you honestly want. but any CFO can help you forecast and project modeling. And so some of the models that we looked at, again, are like bonuses, recruitment, incentives. And so again, the VA's model is pretty interesting. I mean, they broke that up over 12 months at 10% of somebody's salary, which again is a lot of money. If you're getting paid $80,000, right? That's $8,000 in addition. But they're breaking it up monthly over that year so that they can pay it out and spread out that cost. And then again, my model that we've kind of landed with is profit share that we're trying to put out at the last part of the year. Yes, VA, Department of Veterans Affairs. Sorry about that, acronyms. I'll post Amy's and for contact info in here for anybody who's interested. She's a gem and super, super knowledgeable. She works with a handful of other practices, and some are Medicaid based, some are not, some are larger than mine, some are not. So she's well versed in all of it.
So thank you, Amy. And I think the question for my ears makes me wonder if others also want to speak to this challenge and this tension with our budgets. So when we support the workforce in many of the ways that we've talked about, not all of it costs extra money. We do need to note that it doesn't all have to be an increased budget line item. But there are many of the strategies that we talked about that do include that. And of course, that means we advocate with people like Mary and Matt to increase our funding streams. But any thoughts on how you play with that tension between the money that you have available in your fiscal budget and your investment that we know we need to make in our staff, both in recruitment processes and retention? If anybody else wants to speak to how you're managing that or how you're navigating those waters.
Like if you're looking at adding in any sort of hiring bonuses or incentives, I would strongly encourage you to look at recruitment as well, or retention as well then, so that there are two-pronged strategies. I wouldn't do one or the other. You can unintentionally cause a lot of harm, and people can feel like they're not valued, which is the antithesis of what we're trying to go for. So I would strongly encourage, if you're going to do one strategy, look at them both, and not do one or the other.
Thank you, Amy.
So Karen, in our case, it might be different because we are funded via grants as opposed to direct pay. It's a completely different model. But we make sure that whenever we're writing a proposal, we always try to include, a line item, whenever possible, to ensure that there's enough staff training. And we're big on that, ensuring that they feel, that they are not only doing what is required for them to get their licenses and their CEUs and all of that, but also see what is it that it is their area of interest and try to, engage them through that. So they feel like, their desires and their goals are also taken into account. So those conversations happen, where do you see yourself? What do you want to learn more about? And then as we are writing, our grant writer has that, on top of her desk so that she includes all of that. EMDR, child's play therapy. What are the things that they want to know more about?
Excellent. That really speaks to a lot of what Jean was talking about, and then how you implement that and integrate that in throughout your whole process, including asking for funding, including when you're writing an RFP to get a grant. So excellent, thank you. I think I would just say that the other way to flip that question is, what's the cost of not doing this work? What's the cost of not taking care of our staff? We know that retention, when people leave, the turnover rates that we're experiencing now are incredibly expensive. So investing in these new strategies, maybe not new, but newer for many of us, newer for the sector overall, is where we need to go, so we can build a workforce that can do this work in these complex environments. But thank you. So feel free to please put questions in the chat, and Millie is monitoring those questions. There's another one here. Matt and Mary, with the agencies in Tennessee that can now get reimbursed for grad students seeing clients, have there been conversations in those students about those students receiving a stipend or compensation during their placements with the agency?
Yeah, sure. I'll take that. So the short answer is no, but that is the spirit and the intent of the policy. And the longer answer is Tennessee is 100% managed care. So Tencare does not set the rates for these therapy and medication management services. The policy does not say if you do this, then you must provide a compensation, stipend, that type of thing. But it is the spirit of the policy.
Thank you. And one more for Matt and Mary, and then we have some other questions, but are the efforts for adult peers also occurring for family support specialists as well?
Yeah.
Similar to the work that that Ruth does.
Yeah. I'm aware of the work that Ruth does. Yeah, so we in Tennessee do have a family support specialist designation. And I cannot say enough great things about our system of care team here at the department under Carrie Virgo and Brenda Donaldson. They have done an excellent job in bringing additional resources into our system of care program over the past few years. So not only are we getting the SAMHSA discretionary grants, we have recently received grants through the Department of Human Services, through TANF monies. We've basically doubled our SOCAT program in Tennessee, which I bring up because as a result of that, we've doubled the amount of family support specialists that we have working across the continuum. So not only are the FSSs working on high fidelity wraparound teams, we also have them co-responding with our mobile crisis teams. They're working with families in the emergency department setting. So absolutely, as we expand our CPRSs, we are doing so in a parallel way with our family support specialists.
Great, thank you, Matt. Here's a question. How are you practicing intentional inclusion in your workforce, ensuring that staff from minority populations who join your workforce stay in your workforce? So this intentional inclusion, any thoughts that anyone would have related to how we do that?
I'm happy to start that. So we looked at and did we hired a consulting agency last year to do DEI work alongside everybody else in our world, but also to do an internal staff assessment of how are we doing with this practice. The feedback was super helpful, very interesting. And the HR consultants really recommended that we look at what are kind of percentages that would be relevant in our field. So I think we landed with like 85% of our workforce is typically Caucasian, 15% of our workforce is typically BIPOC. And so ideally, our agency would reflect that, right? In Nashville, we have significant immigrant population as well. And so trying to figure out how we can recruit and reflect those communities in addition to the ones listed. So we, again, our strategies for some of this are long. I mean, they're heavy and they're long-standing and they're multi-stepped and staged. And so this isn't anything we resolve or tend to overnight. This is just like living our values of equity out loud. So we recruit from internship programs. That's I think our number one kind of main strategy is building really intentional internship programs, not just with the University of Tennessee or Vanderbilt, but with our African American universities, our FISC, our TSU programs. We have Baylor, we have a Northwestern person right now. So, I mean, it's not just limited to Nashville either. We have the country now that we can utilize. And then ensuring that we're promoting at equitable rates as well from within, that we have opportunities for leaders and that we promote equitably from within across all diversities backgrounds. And so that has been, those have been our primary strategies. We also focus heavily on an internal program called Therapists Are People Too, that we built out, that is a trauma-informed staff kind of retention and recruitment program that focuses on quarterly assessments for burnouts, but it also goes back to what Janine had said of like, what makes you come alive? What do you love? How can you do more of that in your work? So we try very hard to match therapists with clients that they love, that make them come alive, balance their caseloads out, strategize around how they're scheduling their day, which I mean, doesn't sound like a big thing, but if you're back to back 7 clients in a row, it's a big deal. And so we work really hard with our team leads to build that out and be intentional about burnout.
Thank you, Amy. Thank you.
Yeah, I'd like to respond to that as well. One of the things that we do at Allegheny Family Network, I'm really happy to say we have a pretty diverse workforce. And with that, we really look to the staff within and look at their strengths and try to build them up. And so many of our staff started out as families we served, and then they became a family support partner, and then they were promoted maybe to our parent peer advisory board, and then eventually promoted to a supervisor. And we even have one staff member who has been promoted to COO. So, you know, we really try to look at that opportunity for them to be promoted from within. We also, for our family support partners, made 2 levels. So we have a level 1 family support partner and then a level 2 family support partner, depending on what trainings and credentialings they've had. So to be a family support partner 2, they need at least 2 credentials. And then they have to do some other extra things as well. But I think giving your staff opportunities to grow within is really an amazing opportunity for them. And I feel like that helps with retention as well.
Yeah. Thank you, Ruth.
One of the other things we do for wellness is we have a psychologist on that we have as a consultant, and he does things, he helps with our psychological safety, I call it, at the office. And he does groups with the staff on, you know, different kinds of wellness techniques. And he does debriefing with them, because sometimes when they're out in the workforce, they come across some really tough family situations and they need to talk it through. And then if they need to see him one-on-one, we will do that as well. So I think keeping that kind of internal wellness is a big part of keeping staff as well.
Thank you, Ruth, very much.
Karen,
We're about out of, go ahead, Jean.
I just want
go ahead, Jean. Yep.
Really quick, an additional resource specific to social justice and equity work. The National Council for Mental Wellbeing has launched several educational products related to that, including a free webinar series that will extend through the year, and a self-paced workbook, really comprehensive workbook with resources, assessment resources, data resources, change management resources, all dedicated to social justice. It's the Social Justice Leadership Academy. And again, there are several and a growing number of offerings underneath that umbrella. So in the resources after the webinar, I'll make sure there's a link included.
Wonderful. Thank you. Thank you, Jean. One follow-up question, and then I think we're about ready to about at time, but Lisa, can you share more about your mentoring work with other agencies that are serving the Latino community in Georgia?
Sure. We created a cohort of smaller, very small grassroots organizations that want to serve that community, but are lacking the resources or they don't know how to start. So what we do is we create like sessions, like group sessions in which we start vary from the basics. What do you need to get a grant? What do you need in terms of sustainability? The organization of the agency itself. And then we do one-on-one, sessions with them separately. We right now have a cohort of 8 that we're mentoring, and it's going to be a 1-year process. What we intend to do is that to create capacity. Ser Familia has been serving this community for 21 years. In the county where we started, when we started in 2001, there were about 4% Latino. Now we have 14% Latino, but we have 36% of Latino children in the school system. But we're still the only Latino specific organization in that county. And for me, that's never a good thing. That's awful. And as I look into the future, we need to make sure that we create the capacity, the strength in those organizations so that there's more serving. If you are a person that needs mental health services in Spanish, you're an adult and you're undocumented, we're it. And we're this big. And that is certainly a travesty for our community. So we not only want to make our agency more sustainable and increase our capacity, but also bring others with us along the ride.
Well, thank you. Thank you so much. Amazing insights and strategies that you've all shared. Now we're going to start bringing this to a close. And in order to do that, I would just love to go around the group, the 6 of you, and ask you each to share your one final thought, and literally 5 to 10 seconds. So not any more than a short sentence, but what do you want people to leave with today? So I'm going to go in the same order as I have. So Amy.
I think for me, just what has come out of COVID and is very apparent in my team is just that our team went through all that and experienced all that, and they're not okay right now at all. This isn't COVID is not over. And our country continues. I'm from Buffalo, New York, right? Like our country continues to face some very big things that we're kind of rumbling and reckoning, not kind of, we are rumbling and reckoning with. And so again, as leaders, I feel like it's our responsibility to hold them and hold them well in this and provide them with as many resources as we can to wrap around them and ensure their ongoing well-being and sustainability. It is really hard to work with trauma when we are traumatized ourselves, right? As so many of our people are. And so holding our staff first is always going to be at the core of my heart.
Amy, that's amazing. Thank you. And wow, Buffalo has had a hard journey. So little shorter if we can, so we don't run out of time. Jean, real short, 10 seconds.
I'm not a clinician by background, but I've spent my entire career working with you and your staff around the country. And I say this with the greatest sincerity. The work that you're doing, the work that your staff are doing, the work that your colleagues are doing is the most important work on the planet right now. When we look back 10 years from now and we think about this time and space as Amy so eloquently described it, we are going to look back and know that the work that you're doing is the work that has held us together. And
thank you.
And I just, from the bottom of my heart.
Thank you, Jean. Ruth.
I just would like to say that our staff are the people that are out there, and they need to be well. And they need to be healthy so they can continue to do what they do. So I think all of us need to really think about that, make sure that they're okay, their wages are okay, what they need they're receiving, and that they can live a life. And that they can do their job effectively. So I think we just all need to focus on making them healthy and well.
Thank you, Ruth. Belisa.
Diversity is wonderful. Diversity makes us stronger. So let's make a commitment to create diversity in our organizations.
Thank you. Mary?
Mine is a challenge to those of you who are providers out there. Find me and Matt in your state. find me in your state and talk to my peer in your state and let them know what you're facing. Thank you.
Thank you, Mary. And Matt.
Stay hopeful and focus on the good. I mean, we're starting to see stigma abate. That's a great thing. There's additional resources that are coming to bear. You know, the need is greater than it's ever been, but I tell you, this is a great time to be in behavioral health. It's more important than ever. So stay hopeful and recognize all the positive things that are happening across the country. It's a lot.
And with that, we'll close. I will echo comments today to thank our 6 amazing panelists, to thank the Intacc team for making this happen, and then to thank all of you that make this work happen every day and the work that you do every day. So thank you, everyone. And now I'm going to turn it back.
We are here to support you, and we look forward to staying connected. So thank you again, and I hope you all have a wonderful week.